Hello, everyone, and welcome to HeadWise, the videocast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I'm the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. I'm excited to be here today with one of our absolute favorite repeat guests, Dr. Dawn Buse. Hi, Dr. Buse, how are you?
Hi, Dr. Weitzel. I'm doing well. I'm happy to be here. And hi to everyone watching and listening.
So Dr. Buse is a clinical professor of neurology and a psychologist who specializes in headache. She is so well known, so well respected and loved in our community. We are so lucky that she comes on and talks to us about all things related to taking care of ourselves, related to headache and pain psychology. And I am honored every time I get to talk to her. So today we are going to talk about a really important topic that maybe we don't bring up very often, and it is called migraine burnout. Now, you can just replace the word migraine with whatever headache disorder you have, because I think all of us have experienced burnout from our chronic headache or pain condition. And I thought of this because I started feeling a little burnout a couple months ago, taking care of myself and my child who has daily migraine. And it occurred to me that I am sure I am not the only one who has felt this way or is currently feeling this way. And so I talked to Dr. Buse and I thought we should address this problem. And we came up with some really awesome questions, some really awesome things to say. So I hope there's something in this episode for everyone. So Dr. Buse, let's just talk about some reasons why we might experience burnout as people living with migraine or another headache disorder.
Well, life with migraine or another headache disease is it's a marathon, not a
Yeah,
sprint. These are
right,
chronic illnesses. These are long-term, maybe not lifetime, but decades-long chronic illnesses.
right.
Of course, that is exhausting. Life with migraine or other severe headache disease takes its toll in terms of the pain, the discomfort with some of the terrible symptoms that go along with attacks, um, ongoing concerns like always having photophobia or cognitive impairment, kind of feeling like you're not as sharp as you used to be, allodynia, which is when things hurt on your skin that normally don't hurt, like wearing a ponytail. Some of
Mhm.
those symptoms last all the time, even when you're not having attacks. So life with migraine itself is not easy. There's a toll taken on the impact at work and school, always trying to play catch up, feeling concerned that others might be judging you or feeling the stigma of missing out, and the missing out on enjoyable things of life, the social activities, the holidays, the vacations, the special days, the fun times that get stolen away, just the weekends, all of that. That's exhausting. On
Mhm.
top of that, if you're seeking medical treatment, that can be exhausting as well. Sometimes we have to struggle with insurers and payers to get the treatments we need. We have to struggle to find the right doctors, the best doctor for us to get those appointments. There might be long waits to get into those appointments. Once we're there, we have a lot of waits. We might feel like we are kind of moved around through the system, and there are things that we have to do to get to certain treatments, to follow the way that payers have us try multiple treatments of different types of classes before we can try a different type of treatment. This is all exhausting. This can be just
Yes.
exhausting. Of course this can be exhausting. This is a lot, and it goes on for a long time, so it kind of has that feeling of being a relentless or vicious long cycle. So it's not surprising, given all that, whether you're someone with migraine or whether you're caring for someone with migraine, that it's an exhausting process.
Right. And I mean, I will add to that, migraine, chronic migraine, particularly, whether you have it, your loved one has it, or, God forbid, both of you have it, is like a full-time job. And depending on how consistent the pain is, it can really wear you down. And if it's daily, the burnout's going to come fast. But honestly, even if it's not daily, that concern over when is the next attack going to hit will wear on you. The stigma is going to wear on you, especially if you are around it every day. If there are work colleagues that you're feeling stigmatized by, or if there's people in your family you're feeling stigmatized by, this is going to wear on you. And we aren't saying this to bring you down. We're saying this so that you feel validated as we move into this conversation. There's also the financial component. If you are having trouble providing for yourself, or the cost of taking care of yourself or that family member medically because they have a headache condition, is rough. But you brought up the medical appointments, and just as someone who all of the medical appointments I have to go to for myself, and then I'm also taking my child to them, I think that is part of the reason the burnout hit me recently. And I was thinking of having this episode. The doctor's appointments are just incessant. And, how on earth am I going to work between both of us being sick and then both of us going to these doctor's appointments? So if people out there are feeling that way, you're not alone. And also, we're losing loved ones and support system a lot because we have this invisible illness. So here we wanted to throw out, we brainstormed a lot of these reasons that so many of us start to feel burnt out. So Dr. Buse, this is something that you are going to have way more input on than me. What are the signs of burnout?
Well, the idea of burnout originally came in the 70s. It was coined, and it related to work, the workplace.
Mhm.
And there were a couple aspects of burnout. One was not caring anymore.
Mhm.
So maybe you were struggling with trying to make something right, trying to do something, trying to take care of something, and you get to a point where you just say, I throw up my hand, I don't care. So that kind of loss of that connection, the loss of the passion for it, the loss of the caring. That's one of the signs of burnout, just kind of giving up and feeling apathetic about something, feeling hopeless and helpless. Now, these are hallmarks of depression. They're also hallmarks of burnout. So you've got this relentless stressor that no matter what you do, it feels like you're not accomplishing what you want to accomplish. You're not getting past this stressor. You're not getting the results you want.
Mhm.
That can be really exhausting, and that can lead to feeling that you are helpless to make the changes that you want to see, or hopeless that things will get better in the future.
Mhm.
And depersonalization. So starting to lose listening to others, empathy for others, just kind of becoming so overwhelmed that you kind of get a little bit of a harder shell about yourself. These are all symptoms of burnout. They are similar to depression. They're similar to symptoms of depression, but the burnout is really related to a situation, while as the more general depression is often more general. Now, you might say that we know that depression is comorbid with migraine,
Mhm.
and that people with migraine are more likely to have depression, that rates of depression increase with monthly headache day frequency and headache severity. So there's obviously a relationship between migraine and depression. But the difference with the burnout is really the exhaustion, frustration about specific aspects of living with migraine. And we mentioned several. You mentioned financially, it may be affecting you, your work and your income, your ability to go to work, your ability to take promotions or different types of jobs that might bring in more income, or your ability to work at all. And then the direct costs of medical care. Plus, you mentioned all the time out of work to go to medical appointments, the frustration with trying to get to the right treatments for you, be they medication, be they kind of CBT or biofeedback, be they neurostimulation. They can all be difficult to get access to. So here you are trying to care for migraine and trying to do the right things, and it feels like these walls keep getting thrown up. You're just like thwarted on getting to the outcomes that you need, or even getting diagnoses, getting answers that you need. And it's not surprising that after trying, eventually you just want to give up.
Mhm.
And that is burnout.
Right. And I think that my experience of what I felt was burnout, frustration was the biggest word for me. It's when you feel like it's like beating your head against a wall and you're not
Mhm.
actually accomplishing anything. except taking care of this disease that maybe isn't really getting better, at that particular time. You might be in a space where you feel like you're just the same every day. And that's a frustrating space to be in. And as someone who's doesn't really have a memory without experiencing migraine, that space will occur, and it's okay. We move through it. As people with migraine, we move through it. So we discussed that it is similar to depression. And how do we know if we're experiencing burnout instead of depression or overwhelm? Can we speak to that at all?
Depression has some other psychological and physical symptoms that may not occur with burnout. So with depression, there is the feeling of feeling down, sad, or depressed
Right.
many of the days, much of the day. Then there's also this anhedonia. So anhedonia is the idea, hedonism meaning pleasure and
Right.
meaning not. The idea that you are not getting pleasure out of things you used to. So maybe you don't enjoy your hobbies anymore, or social activities, or things you used to enjoy. That's
Mm-hmm.
often a sign of depression. And that might be different than the burnout, which is more focused on a specific situation.
Right.
In depression, you might also have a loss of appetite, or you may eat too much, comfort eating, kind of overeating and gaining weight.
Mm-hmm.
You may have very little energy, or you may feel very agitated and fidgety and restless. So there are some other symptoms of depression. Depression often affects sleep, it affects mood, it affects general kind of quality of life, that may be a little bit more unique to depression. And depression is pretty global. You kind of feel it all of the time.
Okay.
Whereas we're feeling kind of this medical burnout or burnout about life with migraine or any kind of chronic condition, if either you would get access to a treatment and it worked really well, I
Mm-hmm.
would expect that that would lift for you.
Yeah.
Or if you were just to focus on something else, you had a vacation coming up or something you were really excited about, something you enjoy, and you kind of just took your focus off of that topic for a little bit and really let yourself kind of sink into this other activity or this other event, that you can forget about that burnout a little bit. So burnout
Right.
is very situation specific, whereas depression is more global.
Okay. Okay, so I want to address really quick because I do run into this so often. Can burnout be one of the reasons or causes of people with migraine and other headache disorders and diseases that they stop seeking treatment or seeking help
Absolutely.
for themselves?
Oh, absolutely. Absolutely. It may feel sometimes like the system is set up to be such a fortress that
Mm,
you can't get the appointments with the specialist that you need or the doctor you need. You can't get to the treatments you need, be it something that payers or insurances don't cover or support, or you have to go through this process of trying multiple treatments and failing them, so either they don't work well enough for you or you can't tolerate them, the side effects are a problem, and you feel like a
mm,
guinea pig of 3 months of this one, 3 months of that one, 3 months of that one, knowing that they may not work for you. This is very exhausting. We're talking about a burnout with migraine. This could be with any medical condition. You talked about
mm-hmm,
all the appointments, the time away from your regular life, the time away from work, the scheduling, the hours on the phone with insurances, with the hospital. It, as you said, can become another job, and
yeah,
the amount of time, the amount of frustration can be very overwhelming. And it's easy at that point to say, I give up. I give up.
right.
I can't even try. Um, with migraine, if you give up, now, it might be okay to take a little break for a bit, to take a little time off. That might be fine. It might be
Mm,
a time we've got a vacation or summer vacation or winter holidays, and you think, I'm just going to put this on the back burner for a couple weeks and come back to it. Now, that's not always easy when you're hit with migraine attacks, which are painful and have really, really debilitating associated symptoms. So it's not like we can
mm-hmm,
just forget about it, because it might rear its head whether we want it or, rear its head anyway, even if we're
mm-hmm,
taking a little break from pursuing treatment or pursuing the different avenues of getting help. But if you feel like you've hit a wall, maybe take a little time off, or maybe just figure it's time to pivot. It's time to think about something different. Is it a different provider? Is it reaching out to some of the advocacy groups for migraine?
Right.
Is it listening to podcasts, learning new information? Is it trying different treatments other than medication? Trying nutraceuticals, trying neurostimulation, trying behavioral therapy, cognitive behavioral therapy. Back, what can you do to switch it up? How can we switch it up a little bit?
Right.
Now, naturally, migraine waxes and wanes. That's what we know from research. It naturally, without any involvement of treatment or with treatment, you get better periods and you get worse periods. That happens every month for some women. It happens seasonally for many people. It happens over the course of years. It happens over the course of decades. So migraine is fluctuating. Now, some listeners may have daily migraine. They may have continuous pain. I know, Lindsay, you have continuous pain. And that is a particularly exhausting way to live. Because when you have continuous pain, you can't even really hope for that next break. I don't know, does your pain raise and lower? Does it wax and wane, or is it always the same?
Sure. Yeah, it does. And I can say, and the only reason I say this is maybe there's someone out there, or it may give someone hope, or it, someone can relate to it. But I had horrid pain, like almost indescribable migraine plus an additional burning head pain that was a different diagnosis up until the age of 30. And then I got considerably better, but I'm so much better, but I still have daily pain. And I can say that even after getting considerably better and being so grateful, daily pain, it wears on you and you will experience burnout. And so, I mean, don't be hard on yourself if you're burnt out. And how you said to take a vacation, a mental vacation,
a real vacation or a mental vacation. Is there any way? Now, you can't really take a vacation away from your pain. That pain comes with you. So, I mean, what do you do to cope with this?
Well, what I would say, the biggest thing that came to my mind is don't disappear, because what I keep running into is people who just stop seeking treatment altogether. And then they don't even know about the new medicines that have come out that they could be trying. And that to me is so worrisome. So never do that. Never totally disappear, because this is the most exciting time for people with migraine. And so you don't want to disappear. Because there's new things coming out for us to try. But what do I do for myself? I try a new form of meditation, or try Tai Chi, or I find an empowering movie that's going to inspire me. I find something that's going to inspire me. I think that's the most important thing. Or I have this little skill that I call zoom out, because I feel like when we are getting burnt out or stressed out or frustrated, we tend to zoom in with this tiny lens on the world, and things are not good right that moment. But if you zoom out on your life and on the world, it's a much easier perspective to get through what you're going through. And that's one of my favorite skills. And that's my simple term for it is zoom out. So those are some of the things I do. But I think one of the most important things is, sure, take a break from that doctor or get a new one or something, but don't disappear, because there's always new things coming out.
I agree. And I think that is one of the antidotes to burnout is staying hopeful. And we have seen developments in migraine in the past 10 years like we've never seen in the previous 2000 years. There are so many developments in treatments, in medication treatments, in non-medication treatments, in our knowledge. There's so many options to try now that I do want to encourage people to not give up entirely. Even if you do take a little break, take some time off because you're getting burnt out from seeking care, trying to get that care, don't give up, and maybe it's time to switch it up with a different provider, a different health system, going through some different advocacy options, or trying some entirely different types of treatment. Maybe you've never added on biofeedback or cognitive behavioral therapy or neurostimulation or nutraceuticals, or changed your tried to improve your sleep or tried to start exercising, whatever it may be. Now, that's not to put the blame on anybody, because we know
Mhm.
migraine is a kind of genetic neurochemical experience. This is not
Mhm.
your fault. You haven't caused it by not doing X, Y, and Z, or by
Mhm.
doing A, B, and C. So we're not saying that at all. But
Mhm.
when you feel like you're in a rut and nothing's working, take a little break, take a breath, regroup, and then think about trying something different.
Right, right. And focus on those things that are not medically part of your life, that are fun, the friends and etc. And it's interesting how it all starts to fall together again. And that's kind of how we get through those rough, burnt out times, in my opinion, at least.
Yeah,
So,
shifting your focus on
right.
something else for a bit. Also, focusing on situations outside of ourselves can be really helpful. It sounds very
Mhm.
counterintuitive to think if you are suffering and you're in distress, that going to volunteer or to do some
Mhm.
work with, be it an animal shelter, be it refugee, be it making a Thanksgiving or holiday meal for a family in need, whatever it is. You would think, oh, I really need to focus on taking care of myself right now. But there's something very empowering on kind of going outside of ourselves for a moment and
Yes.
focusing on others that can be very fulfilling.
It's very true. And I think even just listening to podcasts like this, going into the groups and knowing that there's other people that experience burnout
Yes,
is hugely empowering and important. So thank you for
absolutely.
doing this with us, Dr. Buse. I think this is going to be important to so many people. Is there anything else you'd like to add before we go today?
Well, I love what you said. If you are experiencing burnout or any of the feelings we talked about, you are not alone. This is
Mhm.
very common. It's not surprising. In fact, if as a human being you didn't feel a little bit overwhelmed, helpless, and hopeless by kind of fighting this uphill battle for a long period of time, that would almost be surprising. I
Right.
think it's actually normal to have some of these feelings. And if you do reach out to other people, you read some of the chats through the National Headache Foundation, the American Migraine Foundation, you kind of listen to what other people are saying, you'll find that not only you're not alone, there's a lot of people in this big boat all together, and
Yes.
there's something very empowering about that. So migraine is not your fault. Other severe
No.
headache diseases are not your fault.
Nope.
And yet we want to give you as many tools as we can to keep you
Mhm.
moving forward and seeking better outcomes. And there are really a lot of therapeutic options that we mix and match and create the perfect best combination for you, that we really expect that many people can experience a great degree of improvement. And so if you
Mhm.
haven't experienced benefits, don't give up. Keep trying.
Right. Well, thank you so much, Dr. Buse. And thank you everyone for tuning in today to HeadWise, the weekly videocast and podcast of the National Headache Foundation. And join us again next week. Bye-bye.